Good morning, ladies and gentlemen. Welcome to my poster section. I'm Xiaoqi Cai from Fujian Hypertension Research Institute of China. It's my great honor today to present one of our research. Endothelial dysfunction was associated with over 10-year prognosis in Southern Chinese, a retrospective cohort study. Endothelial function evaluated by brachial artery flow-mediated dilation (FMD) was shown to predict short-term cardiovascular outcomes in previous study. However, the prediction for long-term prognosis was still unclear. The aim of this study was to explore the relationship between endothelial dysfunction evaluated by brachial artery flow-mediated dilation (FMD) and long-term prognosis in Southern Chinese. This was a retrospective cohort study, including 1,615 patients from the Fuzhou study enrolled from 2000 to 2016. All subjects underwent FMD examination upon enrollment. Meanwhile, clinical information including age, gender, blood pressure, heart rate, and biochemical indicators were recorded. A cut point of FMD less than 8% was used to distinguish normal and abnormal vasodilation. Primary endpoint was defined as all-cause death, and secondary endpoint was defined as non-fatal myocardial infarction and non-fatal stroke. Composite events included both primary and secondary endpoints. At least one endpoint event follow-up was conducted for each subject before 2024, including inpatient visit, outpatient visit, telephone call, and home visit. The date of deaths were collected according to medical records, telephone call, and Chinese household registration system. After a median of 10 years, 1 year at least, 23 years at most, a total of 1,229 participants were ultimately followed up, whom were then divided into normal endothelial function group and ED group. Compared with subjects with normal endothelial function, patients with ED had higher rate of mortality, 13.3% versus 5.2%, and the incidence of composite events, 18.7% versus 8.6%. Figure 1 shows there was a significant difference in the proportion of brachial artery endothelial dysfunction and the value of FMD between the survivors and the decedents. From Figure 2, we can see among patients with hypertension, overweight or obesity, dyslipidemia, metabolic syndrome, the all-cause death mortality and the incidence of composite events was significantly higher in patients with ED than those without. Accumulative survival rate and composite event rate based on different baseline endothelial function was shown in Figure 3A and B. After a judgment of age, gender, body mass index, blood pressure, heart rate, smoking, drinking, biochemical indicators, and medication, antihypertensive medication, statin, and antiplatelet drugs, FMD less than 8% was an independent predictor of endpoint events. The risk of all-cause death in ED patients was twice as low with normal endothelial function, HR 2.0, and the risk of composite events was nearly twice, HR 1.7. Figure 4 showed the predictive value of the parameters for endpoint outcomes in all individuals and in the elderly. Our C-curve analysis conducted in all individuals showed FMD was a moderate predictive parameter for all-cause death, while FMD combined with creatinine showed a better predictive value for all-cause death. However, the predictive value of FMD combined with creatinine was not stronger than age alone in all individuals. In elderly individuals, FMD combined with creatinine showed a better discrimination for all-cause deaths than age. Nevertheless, the predictive ability of FMD combined with creatinine for composite events showed no significant difference compared to age, neither in all individuals nor in the elderly. In conclusion, these findings suggested that FMD or brachial artery was associated with over 10-year prognosis in Southern Chinese. Endothelial dysfunction increased the risk for all-cause mortality and composite events. In clinical practice, brachial artery FMD combined with creatinine may be used to predict all-cause deaths in the elderly. That's all. Thank you for your attention.